there shouldn't be a one-size-fits-all approach. I think it really has to be tailored to the individual guy. My name is David Kealy, Associate Professor, Department of Psychiatry. Before my academic career, I was a clinician. I worked in mental health clinics, and I saw men, I saw women. I did notice that men were not as receptive to services at the same rate that women were, and that men suffered a lot, and it was often hard for them to get help and to find help that was effective. And I guess that stayed with me when I got into my academic work. My work's been, mostly focused on personality and difficulties with self-esteem and with relationships, and in looking at ways of helping people with those problems. I think society can do a lot to help men reach out for support. I think it's an incremental process where we have to keep the conversations alive for men around help seeking, around destigmatizing the need for help. And I think often it happens one person at a time. Men can benefit from services ideally preemptively, when they first notice that they're having some difficulty, if they notice that there's something that they'd like to achieve, that they're feeling impeded in being able to move in that direction. I think reaching out and getting help in some way would be of great benefit, and rather than waiting until things are more dire and desperate. I'd like to see things moving more in that direction, where we can take a more proactive approach to help seeking and the provision of help, where men don't have to have a full symptom profile in order to receive services, that they can reach out and say, look, I'd like to work on something. I feel I'm a bit stuck, or there's something that I'd like to do that I don't feel like I'm able to, and I think that should be a great entry point into getting some help and doing some good work. How can service providers best help men and meet their needs? My take on that is by personalizing their approach to the man, by finding out who he is, what his story is, where the difficulties are for him as a particular individual. There shouldn't be a one-size-fits-all approach. I think it really has to be tailored to the individual guy. One of the most rewarding parts of being connected to the cluster for me is seeing people using different methodologies, addressing a range of questions, working with different populations of men. And it's been very inspiring for my own work, and it's stimulated a lot of thought and questions in my own mind about future work that I'd like to undertake. And I've just been really impressed with that scope and with the impact that people have been having in their work. I don't know that I'd be where I am today without being involved with the cluster and with the men's health research program.